Hello everyone. So in the last video I talked about some people saying the heart rate is at 200 resting. And I talked about how if that's true, things need to be looked at. So I thought I'd go into why that's important to get it looked at, as well as what a few of the things that might cause it, things like that. So why is it important? Your heart is a muscle. The more you use it, the stronger it becomes, but the bigger it becomes. However, there's a problem with the heart. There's only so much room it can use. Our muscles out here, they can keep expanding out. We may get, you see people who are muscle bound, they can't really move very much because their muscles are so large, but there was room for that muscle to grow that big. The problem with the heart is that it's limited by the rib cage and the lungs and all the other organs. Another thing, it will also grow in as it grows out and takes some of the space that the blood goes in. So it's not able to push as much through, so it actually needs to work even harder, which reduces the space, etc. Basically, a heart rate too high for too long will be life-threatening. So I know there's certain conditions that cause the heart rate to be higher, that cause that enlarged heart. POTS is one that comes to mind. However, people who are diagnosed with that, their doctors actually are working with them to bring their heart rate down. So they may have a heart rate that high when they're diagnosed, but then their doctors are put them on medications, different things like that, to try and lower that heart rate, because they don't want that enlarged heart to happen that can actually lead to death. So that's something to be aware of. If your heart rate is too high, no matter what, especially if like you're in the vigorous range or things like that, your heart rate is over the acceptable, like over 85 when you first wake up and you aren't taking it yourself, someone else is taking it for you, different things like that. It's something to bring up to your doctor. If you go into your doctor and your doctor gets your heart rate at 200 and you're 20, that's a pretty good indication you might want to find another doctor if your doctor doesn't say there's a problem. If your doctor sees that and starts, okay, we've got an issue here, we need to find out what's going on, and starts doing work, that's what you want. It's not that you don't need your doctor freaking out on you. That's not good. I have never seen that. But I have heard cases of doctors who are just, I don't know what's going on. I'm not going to pay attention to the symptoms, so I'm going to brush it off because I don't want to do the work to figure out what's going on. Now, what if you go into your doctor and tell your doctor your heart rate's at 200 on a regular basis, and you have had tests in the past, and your doctor brushes it off and says, whatever, ask more questions. Maybe your testing in the past has shown when you're saying it's at 200, it's at 100. Well, if it really is at 100, you're at a normal range. It's fine. They don't need to really worry about it. And so maybe they aren't worried because they think that's what's happening. At that point, it's a good idea to get a smartwatch or something else to be able to prove it's that high. Another idea is to have them take it. If they're seeing it's 220 in the office or 200 or 180, and they've had you sitting on a table doing nothing, someone's been in with you the whole time, they should be concerned. And I would bet they will be. So I hope that helps understand why it's important to get it checked out when it's high, and a little bit about what's going on. And know that I'm not saying it's not possible. I'm just saying it's a concern when that happens. Thanks, and I'll see you in the next video. Bye.